Welcome back, everyone, to Unhoused and Unfiltered. I'm Nick Cook, the Director of Public Policy for the Michigan Coalition Against Homelessness. And as always, joined by my colleague, Sarah Rennie.
Welcome, everybody. I'm excited to be here. I'm Sarah Rennie, the Director of Advocacy and Engagement from the Michigan Coalition Against Homelessness.
Thank you, Sarah. And, this is episode 5, people. And we just ask everyone to continue to like, subscribe, share this podcast, Unhoused and Unfiltered, wherever you get your podcast from, be it Spotify, Apple, wherever. Just share it out, share with families, friends. If you have show ideas, please reach out to us. Let us know what you're thinking about. And it's designed to bring real facts about homelessness in Michigan to you. And that's really what we want to talk about on a daily basis. Break this down, make it understandable to even your family members, your cousin, your brother, and the guy that lives down around the corner from you.
Absolutely, Nick. And also, we want to talk about homelessness as part of our housing crisis. We have an economic and affordability crisis in Michigan, and it's going to be solved only through a multi-pronged effort. So if you know someone who's doing development, landlords, all of those things, please share. We are starting to get a lot of bounce. So your likes and subscribes are making a difference. I also want to pitch. Please remember, in the midst of your liking and subscribing, to not only leave us a review, but consider going to myhomeless.org and becoming a MICA member. We are a membership organization, and it's with your support that we're able to do this advocacy and engagement. So please consider to listen to our podcast, particularly podcast 4. Share that one. We don't want it getting lost because there's a new one, as this new one's going to be very important, but also the veteran guardianship issue is something that's near and dear to both Nick and I's heart, and we want to make sure it gets out to as many folks as possible.
Thank you, Sarah. This is I've just absolutely loved doing these podcasts and talking through all these issues. And today we have a guest with us, a good friend of mine. I've done street outreach with her lately. Haven't known her long. And as I was going through her bio, Sarah, I was super impressed. She does great work in Lansing, Ingham County. Khadijah Erickson, she is a dedicated housing advocate, organizer, and the executive director of the Tenant Resource Center of Mid-Michigan, with years of experience in harm reduction, eviction defense, and grassroots organizing. They have worked tirelessly to ensure Lansing tenants have the tools, knowledge, and support they need to stay housed and assert their rights. Collaboration has been at the heart of Khadijah's work. They have built strong relationships with legal aid organizations, social workers, mutual aid groups, city, county, and state officials to create tenant-focused solutions. Through their leadership, the TRC actively works with community partners to provide eviction defense, housing navigation, and policy advocacy that centers the needs of tenants. As the founder and director of the Hubris Collective, Khadijah has led direct outreach efforts at encampment evictions, ensuring that displaced individuals receive critical support, resources, and advocacy. Their work extends beyond crisis response. Khadijah is also working with the Ingham County Health Department to expand services for people living in encampments, helping to bridge the gap between public health resources and those most in need. Having experienced housing insecurity firsthand, Khadijah understands the challenges tenants face and is deeply committed to building a future where safe, stable housing is a right, not a privilege. And I will say firsthand, Sarah, that Khadijah is very humble. She
Yeah, she's
means
been
so she means so
hiding that
much to every.
bio from us recently.
Uh, so welcome, Khadijah. Thank you for being here today. Thank you for all you do. I mean, there's not a time I go out on the streets in Lansing and somebody goes, "Have you seen Khadijah lately? Do you know where Khadijah is? Do you know?" Um, so your reputation definitely precedes you. But I'd like to know, what can you tell me about the homelessness encampments and the public health crisis, and what are you seeing? What are you doing in that community?
Um, well, I could start by saying we're seeing more people at encampments. We're also seeing like the overall size of encampments shrink down. And so normally, like I would say around this time last year, you would have like 3 to 4 larger encampments, and by that I mean 20 plus people living there. Now it's like maybe 10 people are accumulating in like a traditional type of encampment, and it's more of like 1 or 2 man type setups in further and further places, having to travel farther to find people as displacement action kicks up. But then, as far as like people's health needs, like they run the gamut. A lot of them had like pre-existing medical conditions that they were dealing with before entering into homelessness. So it's a lot of like chronic health conditions. Like we run into a lot of people dealing with diabetes. A lot of people dealing with like heart failure and stuff like that, but then also like the injuries that come with existing outside. So some of the more serious ones, now that we're through the winter, people are going to start asking for more assistance with injuries sustained from cold exposure over the winter. And then as we go into summer, there's not a ton of third places for them to go to beat the
Yeah.
heat. And so we'll see like heat exhaustion and stuff
So,
like that.
that really brings up kind of a interesting thing to talk about is, yeah, what when people are living rough out on the streets, how often do they get to be warm? How often are they wet? How often do they get those cold weather injuries? I know my experience out on the streets that you've seen. Um, you know, are they seeking care regularly, or how do you get somebody to
Um,
to be taken care of?
it is tough, I'll say that. Um, Are people oftentimes dealing with weather? Yes. Anytime it rains and I go to an encampment, they're wet, their stuff is wet. The areas they're in are super prone to flooding. And so there's that. But then also, like I was mentioning, that decrease in third spaces, including like shelter spaces to be even during the daytime, have greatly reduced. And so people's opportunity to seek warmth or like, coolness, I guess, it's very limited, and so most people are trying to make their tents as cool or I guess as temperature controlled as possible. And so that's mainly how people are dealing with the elements, is being outside and then, stealing away little minutes in places that you could be. But they are also facing more, I would call discrimination, in that like there's been a reduction in coffee shops who are allowing unhoused people to just kind of like be in there and chill. There's been a little bit of a chilling effect within like the libraries, which is their main refuge. And then also just, the fact that you have to pay to go to a lot of
Right.
places.
And I think you brought up a good point about the size of the encampments too, because there is safety in numbers.
Yes.
You have those around you trust and being able to check up on you. So what breaking apart of these encampments and making them smaller, what effect have you seen on the unhoused community in Lansing?
Um, I would say people seem like more hopeless and more depressed, and I obviously wouldn't be able to say how much is a part of what, but it's all of it, the breaking up of their community, but also the loss of their property, and like having to develop new routines and routes to get to places as they're spread out, farther and farther apart. Um, yeah, people just seem like sadder overall, and like lacking a lot of hope in that, they're building something out of nothing. I really don't understand why we don't look at these self-made communities for what they are. Like, I mean, people, they don't have anywhere else to go, and these are the people who are willing to spend time around them, right?
Yeah, it is. We've seen a lot of the encampments broken up here. You and I've had many conversations about this. The different encampments where these people, and I think one thing that gets overlooked a lot is when they break these encampments up. Not only are they forced out to someplace else, they lose their goods, but then people like yourself lose contact with them. How do you keep up with those?
Well, first thing I want to say is I don't lose my people. It may be a few weeks, maybe a couple months before I talk to them again, but I don't lose my folks. I always find them again. But you're right, it is a huge expenditure of energy to try and figure out where they go. Sometimes you get lucky and like you're at the encampment when they're getting the announcement, and so you can kind of get an idea of where they plan to land next. But most of the time, with the speed and the amount of encampments that are being evicted in Lansing, we arrive at the encampment after everybody's been dispersed. And so then trying to figure out, like, where would they have gone? You know, considering all of the other spots that they would return to have either been clear cut to make them less appealing to unhoused folks, or you know, what services trying to like remember like what services do they engage with regularly so that I can check at least the areas that are close by there. Yeah, it's just a huge expenditure of energy of just like I have to remap the whole city basically.
Yeah, and you probably have built relationships with them, so you have that worry, like
Yes.
like a a parent or a sibling of these individuals of what happened.
Yes.
And I can't imagine that. Speaking of siblings and a parent, I know we both have experienced it in, children encampment. Are you seeing more children on the streets?
Yes. I would say that there's definitely an uptick in what I've seen is more young families. So like the parents are on the younger side, and then also their children are young. What I've also experienced is that they are more targeted for like shelter diversion, and so that's oftentimes how I'm encountering them is that we're trying to divert them from the street into like emergency shelter at the hotel, which is I would say those requests have skyrocketed like over time. And so, but also just like other signs and evidence because people don't always want to be forthcoming about the fact that they have children there because they are worried that someone, could use that to remove their children from them. And while they don't know, I wouldn't do that because I was unhoused after my divorce with 2 kids and I was living in my car. And so I understand the fear of like being in that situation with children. But there are certainly signs that there are children around, more like kids' toys, diapers, that kind of stuff, just like kind of, kidsy type wrappers. There's plenty of evidence that there's more children existing in encampments.
And with children, I mean, obviously babies and expectant mothers and infants, do you think that's a concern? Do you think, what about the health and safety?
Oh my gosh, yeah. It's concerning because like there's been a fair amount of research done on like the impact that homelessness has on a person from like a mental health perspective and then how they're able to engage with life afterwards. And so that could be really strenuous for a family. It's really like impactful for young children, especially ones who are able to like formulate memories and kind of recall their time in that experience. It's very impactful for them. I'm also very concerned about pregnant people who are in encampments and like their willingness to seek out much needed medical care and support, and with increases in unassisted births, that obviously puts mother and baby in huge risk. And it's all because, they're suffering under the idea that their stint in homelessness is their fault. That tends to be like the biggest deterrent to any of them, regardless of their condition. Seeking out much needed medical care is the fear of being judged or told that they're like a drug seeker or something like that when they clearly need help.
Yeah, and I think that's the frustrating point. We see this across the state that there's an emphasis on maternal health, but we don't see it going out to encampments. We don't see it, and I think that's something we really need to focus on is how do we normalize being an expectant mother in an encampment to ensure that they are getting the services they deserve. Michigan has at one point had one of the highest infant mortality rates in the nation, especially expectant mothers of color.
Yes.
And every life is precious. And how do we make sure that those babies are stay safe? But then there's also the generational poverty where they have the fear of losing the child to CPS and stuff like that. So do do you see some of that challenge back and forth?
Yes, but I think that more people are more of like the service provider side are like thinking outside of the box of how do we make that service delivery happen. There's been too much of a focus on how do we get those people from this spot to that spot in order to seek out these things when the state of Michigan has mobile health units that and will bring out doctors, nurses to come and treat people. And while they may not be able to prescribe there at the encampment, they can begin establishing these very important critical relationships with people so that they can engage with the medical provider that they have a chance of trusting. And so like it's in line with all the other changes that are being made in terms of how we're engaging with homelessness, is that like we need to go to them and not the other way around. Mobile clinics are super wonderful to make sure people are able to access care, and also are great sources of referrals. And I have found that when we do bring the mobile health unit out to encampments, people are more likely to engage with the referral system and show up for appointments so that they can get more in-depth testing, talk more privately sometimes, or do other stuff. And so like it seems to be that it has to be part of bridging the gap is that we actually bridge the gap literally ourselves by going to them and meeting with them where they're at, because that's part of breaking down the stigma. None of them believe that people who are service providers or exist in the offices would ever leave that environment and go to where they are. And like every time I've been successful in making that happen, it is a major improvement. Dietrich Encampment is a huge example of that, in that it started out with me, going to the County Health Department. I was like, hey, what can we do to like actually like go to these folks? Like, would you come with me to the camp and like meet them? Will you do referrals there? And that was great.
I think you bring up a great point about where the investments need to be. And, Sarah and I talk about this all the time. The street outreach is important because I don't know how many times during this conversation you said trust, relationship, going out there, because you can make so much happen by just going to their home and talking to them. Find out what Sarah's favorite thing is: trauma-informed care. What supports do they need?
And I want to circle back to something you said that was really important, Khadijah. I'm a huge, and I know you are too, advocate for maternal health. You mentioned unassisted births, and I know that's got to be, I know that the stats are really bad for folks who are homeless, for infant mortality and maternal mortality. But I think people really need to understand what we use the words we mean. We mean people having babies in their car or in a tent without any medical supports. This isn't, unassisted birth, but we chose to get a midwife in our, have a pool in our backyard. This is folks living rough, birthing babies. And I think any civilized society, we think that's a bad idea. I would also like to ask you, because as much as I agree with you on the moral and people deserve respect and dignity, it also reduces long-term medical costs, right? If babies are cared for, if somebody who has a wound doesn't end up with gangrene, it's essentially preventative care that reduces the costs of Medicaid and burden on hospitals. Can you talk sort of more about what you've seen on that and your thoughts?
Yeah, so I feel like my thoughts are really encapsulated in the idea of like we have to be doing the work to build the relationships. All of this is built on people being able to trust the information that they're giving will be treated with the care and respect it deserves, but also being able to trust the information being received by them. And so we would see less women living rough, or I guess people who are able to give birth living rough and having unassisted birth, which, yes, means there are no medical professionals in sight, period, to assist with the birthing process, which is incredibly dangerous, especially if you haven't been able to get to any of your prenatal appointments or anything like that. You don't really have a clear picture of, could you be, preeclamptic, which is a serious health issue that has more dangerous after the birth, where you are in danger of hemorrhaging and bleeding to death, right? And so, again, like, we have to be building relationships, right? Their trust has been broken in a really fundamental way. The more contacts they have with people, the more opportunity we have to resource them. I don't know every possible resource available around, but the more people I can get them in contact with, the more opportunity there is for them to be connected with the appropriate resources, because it's never just one, really, to help them move forward. But also, like, it does reduce medical costs overall because we're teaching someone to invest in themselves and that they are worth the time and effort it takes to remain healthy, which is something that prevents people from seeking out the care in the first place. Is there's a fundamental belief within the homeless population that they are not worth the time or attention it takes to change their life, and that is simply not true. The fact that they breathe air means that they are worth the time and effort it will take to ensure that they can live a long, healthy life. And we have to be engaging with them in a way that helps empower them and builds that sense of self-love and self-respect so that they can be on the receiving end of that from people like myself and like you and other people who want to see them succeed. And so it all comes back to that relationship building, that trust building, being consistent and actually showing up for them and like being where they're at, so that like the research shows again and again, the less distance someone has to travel in order to access resources, the more likely they are to engage with it.
That
I
that is a
also want to,
yeah. Oh,
Nick,
go ahead, Sarah.
let me elbow in here. I just want to do a quick follow-up, because for one, Khadijah, you're amazing. Thank you for your passion and all of your commitment. It's incredible. I did, a decade of work with domestic violence victims, and I want to reemphasize that domestic violence is the leading cause of homelessness among women. And you mentioned that lots of people who are listening to this might be like, well, why do you mean that their trust has been fundamentally broken? If you're a victim of violence, you don't think you're going to end up on the streets. You think that the system's going to work correctly. And that is something I just want you maybe to talk more about in terms of why folks' trust is broken. And then my follow-up is sort of not as exactly as related, but we talked about the physical costs of maybe giving birth at the camp. But I also am a huge proponent for uh, postpartum care, and postpartum depression has got to be worse in camps than just by the physical difficulties of having to recover in a space that isn't necessarily warm or cool, where there's these heat related issues.
Yeah. Um, I I'm sorry, could you just hit me with the two questions again?
So, to what extent, why are folks' trust is fundamentally broken, which is
Yes.
something you said. Now, I sort of talked about
Mhm,
domestic violence.
mhm.
And then two, what does this do for folks with, postpartum? Just to talk a little bit more about what it's like to
Okay.
care for an infant
I
after
thought
giving
those
birth.
were the questions, but I just wanted to make sure I kind of got lost in my own
I did
thoughts
not
for
make
a
it easy
second.
for you, so I appreciate you asking.
Um, so for the domestic violence part, I'd actually like to answer it in two ways. One is from like a process standpoint and how someone's trust is broken. On average, for a person who is housed and attempting to flee a domestic violence situation across Michigan, it costs them at least $2,200 to vacate the place that they're at. And so they already need to have $2,200 at least in the bank in order to escape, a small claims court situation later where the landlord is not entitled to evict them while trying to flee domestic violence, but they could still be on the hook for money through the small claims process, of course, depending on how much it is. So there's also that. And so when they're in that situation and they're realizing I need to accumulate over $2,000 in a very short period of time, they're going to start reaching out to resources, trying to access financial assistance that's not there because it's locked up behind the eviction process. And so then they're trying to reach out to family. And of course, the situation is complicated because maybe family wasn't aware. And having to reveal all of that at the same time while also making a financial ask can be sometimes a bridge too far for people, or they simply do not have the community support for that to be feasible, right? And then when that falls through, they attempt to seek shelter, at a DV specific place, and there's no room because there are so many people trying to flee and escape, and they're all full. And so then a general use shelter probably won't accept them because of the security risk, and so that's also not an option. And they may try a family shelter, but again, unless they have security, they're not going to accept them because of their situation, right? And so already, just on a fundamental scale, they've attempted to flee, which is exactly what all of us have been telling them to do. And then as soon as they initiate that process, there is nothing available to truly support them through that process. Beyond that, once they do make it into homelessness, if that's where they're able to go because there's nowhere else to be, we see instances of domestic violence tend to skyrocket once you're in homelessness, because, you know, if I could speak frankly, police do not care. They are not investigating calls regardless of the gamut that it runs, whether it's for active domestic violence or because a pack of gum was stolen. And so if they try to repeat the process of escaping domestic violence again, they will face just more brick walls, right? And so you can see how that internally, like, how do you not internalize that as someone who's not, again, worth the time and effort it takes to crawl out of the situation when everyone you told would be there to assist you either couldn't because of their own economic conditions are too much for them to offer you that kind of support, or the funding wasn't there from the organizations, or they can't protect you. Literally, the reason that they're turning you away from emergency shelter is because they cannot protect you and their other guests.
And that would break anybody's trust, and it would be scary. And
Absolutely.
why would so? Yeah, I mean, I don't think people think of that all the time.
No, and so, but I feel like that's a problem commonly and fundamentally with homelessness crisis, is we don't spend enough time talking about the situation holistically. One of the things that I do when I get a captive audience like this, but I don't need to do it to you guys, is I will explain to them, like, what is the process to just access a housing voucher? And they're exhausted to just hear me list all the steps, right? But we don't talk about it enough about what we're actually asking our neighbors to do to escape poverty. And at the same time, we are crushing them by reducing the amount of assistance we're willing to provide, whether that be financial, through affordable housing projects, through like training programs, job readiness, making sure that they have access, to pro bono attorneys to help with disability claims. Like these are all things that people desperately need in order to lift themselves out of it, while also dealing with this gigantic myth that the reason that they're in homelessness is because they were somehow too irresponsible.
Right. And I think that's Sarah and I say this all the time, is there's 33,000 unhoused individuals in the state of Michigan.
Yes.
There's 33,000 stories.
Yes.
And we talk about the economic issues, we talk about the domestic violence, but at the end of the day, there's somebody behind each story, and their story is different. And I mean, thank you for highlighting that. And I know we don't have much longer with you. And one of the ways that you and I became friends was criminalization of homelessness. Yes. And you and I spent, especially you, I kind of came in a little bit later on the East Lansing criminalization. Mm-hmm. Can you talk about what camp banning, when they ban camps, when they ban loitering, and they put other restrictions on just existing, what does that do for the homeless, and why doesn't it work, in your opinion?
In my opinion, they don't work because you can't police your way out of homelessness. If we want the issue to go away, it is to literally put them into housing. It would be cheaper overall to just put people into housing and pay for it, call it a day. But additionally, every time that you add a charge, whether it be a citation, a misdemeanor, or a felony, when there are fines that are racking up, which also become misdemeanors and felonies and can also lead to jail time, you're putting people farther and farther away from resources. When people have warrants, they try really hard not to engage with me, but I'm a difficult person to slip, so we push through it. But it makes them antsy about engaging with services because there's a fear that they may be reported, if they don't perform a certain way, maybe somebody will call in about their warrants or something like that. I've personally never seen that happen, but it's a fear that people have. And so, but also, again, like, we have to circle back to, like, the traumatic impact of of being told there's nowhere for you to be. You can't be anywhere in public. You can't be anywhere in private. And on top of that, you cannot afford the housing around you, right? There's no room for you in our shelters. And so, like, what does that do to a person? Beyond just how it increases emergency room visits, overdose deaths, again, mutilations is what I would call them at this point when people are dealing with like frostnip and frostbite. That is a permanently disabling condition.
Yeah.
If you get it on your hands or feet and they go black, I've had the beginning stages of frostbite on my feet, so I know it's debilitating.
Yeah.
Right, and I could still walk and stuff, but I have lifelong impacts of just experiencing the beginning stages. So it just doesn't work because like they need to have somewhere to go, right? If those people could afford the housing around them, that's where they would be.
Yeah, you're marginalizing a population that's already marginalized, and you're pushing them further and further to the periphery.
Absolutely. And additionally, I would just say that it frays the community, right? It puts housed people in a position of essentially reporting on their unhoused neighbors, becoming their own mini police officers, and watching who is in the neighborhood in order to ensure that these encampments don't arise. And of course, it ignores the actual issue, which is that we do not have enough affordable and available housing for people to access. If we lowered the cost of rent, if we made it easier for people to access benefit programs that they needed, but also spent as much, if not more time on prevention measures and keeping people where they're at, we wouldn't have the issue that we're in now.
And you're exactly right. Now, we both adore your passion for this, and we love your energy, and we wish we could clone you to all of our listeners. But if you have one thing to let everybody know that listens to this podcast, what would that one nugget be? What would that one thing you want them to know about the unhoused community?
Every single one of them intends to go back inside. I've never gone to an encampment and not seen signs of people accumulating items that they intend to bring inside. They intend to have a household again. They intend to be a part of society again. And regardless of their housing status, these are our neighbors. They're my neighbors and they're your neighbors. And they are so worthy of your dignity and respect.
Khadijah, that's perfect. Really appreciate you being here today. We will definitely have you on again because we love your passion. So thank you, thank you, thank you.
Thank you.
I can't stress enough how amazing you are. Thank you, Khadijah. Wow, Nick, thank you so much for having Khadijah on. The work you guys do together is amazing. And she sort of cemented things I knew, which was from the social science, which is that folks who have experienced homelessness or are experiencing homelessness, it just takes years off your life, right? It's the medical complications, the long-term effects of being exposed to cold weather, the effects of, you know, having a baby outside, and then maybe the postpartum issues and the issues for the baby, all of which, the science says the outcomes aren't good, unfortunately. And it's great to have Khadijah put a face on that and then provide ways in which we can make changes to those outcomes. So again, I really would love for you to talk a little bit about your thoughts on our push for street outreach, because I can't emphasize enough how it's sort of key to what we want to do for folks.
It's you bring up a good point on the street outreach, and Khadijah is very passionate about street outreach and a good advocate for street outreach, and talks about the great outcomes. Just from my experience of going out on the streets and making connections, it takes 2, 3, 4 visits, depending on the individual, to build that relationship. I talk about one of the individuals that now he hears us coming. He's like, "Oh, I get to hear the dad jokes again. Oh, you guys." But at first, he wouldn't
I
even
mean,
come
you
out.
do have dad jokes.
Yes,
Like,
that
not
is
gonna
true.
lie.
But first couple times we went, he wouldn't even come out of his tent. Now he hears us coming, he gets out of his tent, and it takes that. Now, if it's somebody that has stayed in their tent and you want them to automatically go get resources because somebody showed up there to evict them, that's going to be tough. They don't trust the system. They don't trust the individuals that have shown up to their encampment to evict them. So we need to invest more into that street outreach to get
Well,
people connected to those resources.
and I want to emphasize you do this for free because of who you are and your commitment to vets. And Khadijah's doing this on a shoestring budget. How much again does Ingham County even get to do street outreach for that population? It's not much.
Street, yeah, it's about $18,000. So you're talking about a city the size of Lansing, which isn't all of Ingham County, which is 110,000 people. They have $18,000 to do that street outreach. I count the number of encampments that I went to the other night. Um,
How
just
many did you go to?
well, we saw 112 people on the street,
Wow.
and we drove around all night. Like Khadijah said, that they're really communities are trying to stop these larger encampments. So you see two, three people huddled up together. So what used to
You guys
be
are
two
truly
or
doing
three,
God's work.
thank
But
you. Instead of doing two or three stops, now we're making 10, 15 stops. Or you go to an encampment and they've been kicked out of there. So now you're trying to, just like Khadijah says, she doesn't lose she doesn't lose her people. It takes a while to find them again. And that's everybody that does street outreach. That's what they try to do. They try to make those connections and continue to go. But there's just not enough people. Like you
yeah,
said,
and I guess the point I'm making, like, it's wonderful you guys are doing heroic work, but there's no money. Like, we get donated food, you get don't you take the cost of gas is going up. We really need people to invest in supporting this kind of outreach. We need money to
yeah,
support this kind of work.
and that's really where the progress is made when it comes to reducing homelessness is getting into those individuals at their home, making those connections and continuing to build those relationships, build that trust back. I really appreciated both your and Khadijah's points on the breaking of the trust. It's something you don't really think of is why is that trust broken? And it could be for many, many reasons. But domestic violence for women is huge.
And I want to add, we need money so my pitch is, for anyone who has control in the state legislature, who is a philanthropic, does philanthropic work. I cannot say the word today. Um, consider supporting street outreach. I would like to, as we move forward, also emphasize that trust issue. Um, Coming back to what we talked about last week, this is why veterans may not engage, right? If the VA is saying we might take your rights away, um, why would they come in? Why would they trust you? And so I
Right.
was hoping you would just lift up again what we talked about last week because I cannot stress enough just how unfair it is to folks who, served our country and saw combat.
You bring up a great point on the veteran guardianship conservatorship. It takes, I can't remember the number of times it takes for a veteran to go in or at least go into the VA to make that connection and then ask for help and then be told, you know what, we'll get you help, but you have to give away your rights to make decisions on where you live and your money. We're going to make all those decisions for you. And even when the person entered the service, they still had the right to decide how they spent their money, make decisions on what they did in their free time. And now you're telling them they can't do that. It really breaks that trust in a system that they were told would be there when they needed it. That's one thing, we in the veterans community have a lot of discussions on is we were told that there would be health care, that they would be told that we would be taken care of when we got older. But now you're saying, yeah, we'll take care of you, but you're going to lose your rights. You're going to have to sign those away to us or go to probate court and defend yourself on why you should still be able to make decisions. And that right there breaks the trust in what the veterans signed up to do and where and what was promised to them when they signed up. And it's just, it's scary that we're talking about forced treatment, forced institutionalization for veterans communities, because then what are we going to do? A year, 2 years down the road, are we going to start doing this to all those that are unhoused? Are we going to do that for those that are at the risk of becoming homeless? Um, so
Well,
those
who's
are.
to say that the folks making those decisions are going to make better decisions for individuals? We don't have systems in place. It's pretty presumptuous to assume that the government's going to be able to make better decisions for individuals at all. It should be a pretty rare thing, right, to take away someone's right to make everyday decisions,
Mm.
let alone folks who are in veterans.
Yeah, and we saw things like this coming, right? We saw the executive order in July talk about crime and disorder on the streets, and the institutionalization of individuals into mental health treatment and to substance use disorder treatment. Again, none of it being funded by the federal government, just telling locals that this is what you must do. Um, but we should have seen this coming. It was kind of a telegraph.
Yeah. And that sort of brings us next. In the next few weeks, we'll be talking about the new notice of funding opportunity, which is also being telegraphed, which is that $108 million that supports folks in homelessness. It's being telegraphed to be sort of more of the same. So as we get more updates, we'll continue to stay tuned. I can't stress enough how much I'm hoping you'll not only share this podcast and review it, but go back and listen to podcast 4 and share it widely, and continue to work in your communities to support affordable housing, workforce development, and supports and outreach for folks who are homeless in your community. Please like and subscribe on Housed and Unfiltered, and please become a member of MICA. We do this because we care, and we are very, very passionate about getting this out to folks who need to know more about what actually is happening on the ground. And Khadijah is a shining example of folks who do more with less because she cares. She deserves to be honored, and folks who are getting her support deserve as much as we can give them. Nick?
And I want to remind everybody of the one thing she said, that these are your neighbors, these are your family members, these are people. And I think we need to really take that to heart. We need to have more discussions about their stories. And I'm really glad that she highlighted that. And I think it's very impactful. And as we continue with these podcasts, and we can only continue these podcasts and as long as we have your support. So like, subscribe, review them, join Micah, because we can do this because of all of the support we have right now. But we can do so much more with everybody on team working together. So thank you all for joining. I'm Nick Cook, the Director of Public Policy for the Michigan Coalition Against Homelessness. As always, was joined with my colleague,
Sarah Rennie, Director of Advocacy and Engagement. We'll see you next week.
See you next week. Thank you.